Good afternoon. My name is Thomas Cherian. I am a professor of liver transplantation working in South Asian Liver Institute. Many people and patients whom I meet suffer with one condition called ascites. ये जो ascites क्या होता है? So what is ascites? So ascites is collection of fluid in the abdomen due to liver failure. The first point I want to make is ascites is an important sign. It suggests that the function of the liver has deteriorated, often to less than 80%, and therefore it is a sign of late or what I call end stage liver disease. But occasionally ascites at a very early stage can be well controlled with medication. So the first treatment option for patients with liver disease who have ascites is medications, controlling the fluid. The liver, because it is spoiled, produces a little tightness, and therefore the blood is not able to flow into the liver, and that is what causes the increase in blood pressure inside the portal system, and that causes ascites. Therefore, when you do a transplant, the pressure in the portal system comes back to normal, and that is how the ascites disappears. So the key question that everybody wants to know is, what should we do if we have ascites? I feel that the first point is that we must investigate this carefully so that we find out why people have got ascites, what is the stage of liver disease, what is the cause of liver disease. Even with ascites, even if it is at an early stage, then what we can do is try to reverse the liver disease. For example, if it is due to fatty liver, we can try, at least try, to bring down the level of fat, bring down the sugar levels, increase the insulin. So improving liver function, and when liver function improves, there is a chance that we will be able to improve the ascites or the water in the abdomen. Now, in some patients, unfortunately, they have reached a very late stage, and once there is large amount of ascites, usually these patients end up needing a liver transplant surgery. But I must say that the risk of a liver transplant surgery is much less than the risk of continuing with ascites. बहुत लोग बोलते हैं कि अगर ascites है तो हम टैपिंग करेंगे, मगर बहुत बार टैपिंग करने में रिस्क है, डेंजर है. Better that before any complications happen from ascites, to get a liver transplant done. At least I think my suggestion would be is take 2 or 3 opinions, see what the doctors are suggesting, and consider these options before taking a final call on what to do. With small amount of medications, we can control ascites sometimes for months, sometimes for years. But the problem with using these medications is sometimes they produce a negative effect on the kidneys. And if we see that your creatinine is going up, that is a sign that a second organ, और एक organ भी अभी involve हो चुका है. We don't like to do that, and therefore we would prefer not to involve any other organs and do a clean transplant, so that after the transplant your kidney is good, your liver is also good. Whereas if you wait too long and if we use too many water tablets like lactulose and diuretics, like spironolactone or lacilactone or furosemide, all these things can potentially have a negative effect on the kidneys and then cause a problem, because then 2 organs are involved. Therefore, in conclusion, ascites is the buildup of fluid in the abdomen. We always worry about such patients, because it's a sign that a large part of the function of the liver has been has disappeared, and therefore often with medications we are not able to give the patients a good quality of life, and we might have to transplant. But very rarely patients are there whom we can maintain long term with diuretics and try and get them better. I hope this is useful. This advice is not to replace medical advice, but just a guide to patients who might be suffering with fluid accumulation in the abdomen.